Coming up on Network Africa. President Cyril Ramaphosa announces new tougher coronavirus restrictions a day after South Africa recorded more than 1 million COVID-19 cases. 3 French soldiers killed in Mali after an improvised explosive device hit their armored vehicle. Plus, Burkina Faso's President Marc Kabore, sworn in for a second term in office, vows to reconcile the West African nation. Hello and welcome to the program. I'm Teniola Shoboale. We begin today in South Africa, where the government has announced a return to tougher COVID-19 restrictions following the recent surge in the number of confirmed and active cases, which saw the country cross the 1 million mark in the number of recorded cases. While addressing the nation, President Cyril Ramaphosa appealed to people to adhere more to health safety regulations. More hotspots have also been added to the list, including Johannesburg and Pretoria. The president announced a return to an adjusted level 3 lockdown regulations, which includes the ban on the sale of alcohol, closure of beaches, and a review of curfew time from 9 p.m. to 6 a.m.
All indoor and outdoor gatherings will be prohibited for 14 days from midnight to night, except for funerals and other limited exceptions as detailed in the regulations, such as restaurants, museums, gyms, casinos. These will further be set out by the minister in regulations and will be reviewed after that period. Funerals may not be attended by more than 50 people with social distancing. The nationwide curfew will be extended from 9 p.m. to 6 a.m. Apart from permitted workers and for medical and security emergencies, from now on it is compulsory for every person to wear a mask in a public space. A person who does not wear a mask could be arrested and prosecuted. On conviction, they will be liable to a fine or to imprisonment for a period not exceeding 6 months. Under the strengthened regulations, the sale of alcohol from retail outlets and on-site consumption of alcohol will not be permitted.
Our South Africa Bureau Chief Betty Dibia joins us live on the program for more on this story. Betty, it seems COVID-19 is a gift that keeps on giving. How are South Africans reacting to the new coronavirus restrictions announced by President Ramaphosa?
Well, what I can say is that it's not easy being in government. You know, whatever it is you do will not totally be accepted, and there are those who are happy, but depending on the sector of the economy that you're in, they're happy, but you know, what is relative to you. So there are people who are complaining, there are people who are happy, especially those in the health sector. I was just listening to a nurse in one of the hospitals in the Western Cape saying that since midnight to now, the number of resuscitations, alcohol-related trauma cases that they've had to face has drastically gone down. So there are many who are happy in the health sector, the healthcare practitioners, and then those whose businesses, if you own a bar, of course, you know that business is gone for this festive season, at least for the next 2 weeks, except government reviews it as the president has promised for the 15th of January. So it all depends, but people are hoping the numbers will go down. They've gone down relatively compared to what we had between Christmas Eve and I think on Sunday or yesterday. It's gone down, but we know that between Christmas Eve and yesterday we had over 50,000 cases. So the numbers have gone from 14,000 plus to what we recorded yesterday, about 7,000 plus. People are happy, but I think that's the way I can leave it.
Taking a look at the situation in the country now, some hospitals and medical centres have reported a huge rise in admissions, putting a heavy strain on resources. What effort is the government making to cushion the impact of this new COVID-19 variant on the country's medical infrastructure?
Well, this is part of what the president announced yesterday, the restrictions banning the sale and consumption of alcohol publicly. Although the people in that sector are worried that the underground sale will continue, and then that will have people packed up in hidden spaces and not helping matters with regard to the spread of the virus. But government is trying to reduce pressure, generally on the health care facilities, so that they will be able to cope. Remember, it's not only coronavirus that the healthcare sector is dealing with. So if you have reduced number of trauma cases that would distract from dealing with COVID and stopping or helping the healthcare practitioners having to deal with decisions, ethical decisions, probably difficult decisions regarding who to treat first, so that's what the government is trying to do. Although there are people who pointed out that if you don't stop movement, which is not part of what has been banned at this point, interprovincial and general movement, then the situation may not really be helped. But generally, the restrictions that have been put in place till the 15th of January may be reviewed to continue, or we go back to level 1. That's what basically the government has done now. How effective that will be is another case.
All right then, Betty, thank you so much for bringing us up to speed, and do stay safe.
You too. Thank you so much.
Still on the pandemic, experts from the World Health Organization have described the COVID-19 pandemic as a wake-up call in their final news briefing of the year. Mike Ryan, Executive Director of the WHO's Health Emergencies Program, says that though the pandemic has been very severe, it could be followed by even more lethal infections. Maria Van Kerkhove, the WHO technical lead on COVID-19, called for more resolve to end the pandemic, saying that mutations of the virus, including those seen in South Africa and in the UK, could all be controlled with existing measures and tools such as vaccines.
This pandemic has been very severe. It's spread around the world extremely quickly and has affected every corner of this planet. But this is not necessarily the big one. This virus is very transmissible. And it kills people, and it has deprived so many people of loved ones. But its current case fatality is reasonably low in comparison to other emerging diseases. This is a wake-up call. We are learning now how to do things better, how to do science better, how to do logistics better, how to do training better, how to do governance better, how to communicate better. We've developed a whole new science of epidemiology and advanced behavioral science in this way.
We have to, these variants, if we didn't have a wake-up call before, we have an even further wake-up call about these mutations. You've heard everyone here say that these mutations will continue to happen, and we need even more resolve. I know everyone is tired. I know that, we're all kind of fed up with this and we want this to be over. But this should push us even further to have even more resolve to end this pandemic. Vaccines and vaccinations are coming online. This is another incredibly powerful tool. We cannot lose this battle now.
Well, let's get more on this story from a public health physician, Dr. Akele Ishaku. Thank you so much for joining us on the program. The world is still battling to overcome the COVID-19 pandemic, yet the World Health Organization is warning that more lethal infections could follow. How should the world, especially Africa, react to this warning?
I think we need to, thanks for having me on this platform. And I think most especially Africa, we need to take this warning seriously. This is because these are warnings coming from expert organizations. What we just need to do more as a country, as a continent, is to look inward and begin to come up with strategies to begin to limit the transmissibility of this virus within population. What we also need to do as a country is to also apply stringent measures in terms of travel measures. For example, we have gotten new from the UK. We have also gotten new variants now from from South Africa. So as a country, as Nigeria, we need to also place a stringent measures that for most of our returnees or travelers from United Kingdom and South Africa needs to also be subjected to a longer isolation period and quarantine periods, so that we can be able to monitor this new strain and begin with measures that we can begin to handle this, tackle this. And I think it's quite key. As a continent too, we need also a lot of programs to target even the older population. As a country in Nigeria, we don't have health programs, health insurance programs that target the old population. So we need to do more in terms of coming up with innovative, strategic ideas that will help the teeming older population, which is quite key. And I hope that you know that the new variant has 70% transmissible potentials among the young population. So time has come now for us to also look inward and begin to come up with strategies on how we can improve adherence to non-pharmaceutical rules, and then to begin to see how we can begin to establish social distance.
You know, like you've mentioned, the COVID-19 pandemic has taken a new turn with the discovery of new variants in the UK and in South Africa. There are reports of a new variant here in Nigeria as well. What more can Nigeria do to fight this pandemic once and for all?
So I think over the last 9 months, what we have seen in my involvement in the rapid response to this pandemic is that there has been a lot of non-compliance and non-adherence to non-pharmaceutical safety rules. And what I want the Presidential Task Force to do and other State Emergency Operational Center to do is to begin to identify faith-based organizations to begin to drive this process of risk communication to people. Secondly, we need to do enforcement of non-pharmaceutical. In the UK, you pay £6,000 if you don't wear a face mask. So I believe that let us find people that refuse to wear a face mask. So we need a task force, a COVID-19 task force in every local government, in every ward, that must ensure that people comply with the non-pharmaceutical rule. It is quite key. The new variant, the transmissible potential is very, very high. And we also need to consider the reopening of our schools in January. So based on my own thinking is that we might need to extend it to around February to look at how the cases are going to come down before we reopened our tertiary institutions. We need to also come up with youth celebrities. The NSAS, a lot of celebrities were involved, and the movement drew attention. So what stops us from also using celebrities to begin to pass this message of compliance to the non-pharmaceutical rule, which is quite key. So I believe that we need to rejig our strategy on risk communication. We need to do a lot of case management, in-house case management. So the issue of people receiving treatment at home and then not complying with safety protocol is not there. So for any person that is possible, we can activate our treatment center and then let them come in and get treated and then get discharged, so that we can cut down the pathway of this infection, and then we can be able to know the dynamics of the disease transmission.
All right, then.
The second variant may not be a problem, but we shall be.
Dr. Ishaku, thank you so much. Some very interesting thoughts shared there. Thank you so much for joining us on Network Africa. Still to come on the program. Algerian olive farmers look for solutions to save this year's harvest, which they say has been impacted by the coronavirus pandemic and increasingly unstable weather. Please stay with us. Thanks for staying with us. Still on the COVID-19 pandemic, Director General of the World Health Organization, Tedros Ghebreyesus, says that the coronavirus has exposed the level of inequity, poverty and exclusion in the society. The WHO chief says addressing health concerns alone would not be a solution. Rather, the inequity in society must be addressed.
I think this virus has exposed our societies, exposed us, exposed the problems that we have, the level of inequity, the level of poverty, the level of exclusion. So, health alone will not be a solution. We have to address the root cause of the problem too, the inequity in our society. All the exclusions, racism, all the roots behind the problem. And that means implementing the Sustainable Development Goals in its fullest, caring about our world, the planet, including climate change and the rest. So implementing the Sustainable Development Goals and achieving the goals we have set ourselves by 2030. And even more ambition will be necessary.
UN Secretary General Antonio Guterres has sent a message of healing to the world for 2021, a year he praised will bring rays of hope. In his New Year's message, Mr. Guterres says that the world should work in unity and solidarity against the backdrop of a year dominated by the COVID-19 pandemic and the persistent suffering and grief it has brought with it.
2020 has been a year of trials, tragedies and tears. COVID-19 upended our lives and plunged the world into suffering and grief. So many loved ones have been lost, and the pandemic rages on, creating new waves of sickness and death. Poverty, inequality, and hunger are rising. Jobs are disappearing and debts are mounting. Children are struggling. Violence in the home is increasing and insecurity is everywhere. But the new year lies ahead, and with it we see rays of hope. People extending a helping hand to neighbors and strangers, frontline workers giving their all, scientists developing vaccines in record time, countries making new commitments to prevent climate catastrophe. If we work together in unity and solidarity, these rays of hope can reach around the world. That's the lesson of this most difficult year. Both climate change and the COVID-19 pandemic are crises that can only be addressed by everyone together as part of a transition to an inclusive and sustainable future. The central ambition of the United Nations for 2021 is to build a global coalition for carbon neutrality, net zero emissions by 2050. Every government, city, business and individual can play a part in achieving this vision. Together, let's make peace among ourselves and with nature, tackle the climate crisis, stop the spread of COVID-19 and make 2021 a year of healing.
To security matters now. The French government says a roadside bomb killed 3 French soldiers on Monday. This comes after their armored vehicle struck the explosive device in the Ombori region of Mali. The soldiers were part of France's Operation Barkhane mission, which is fighting an Islamist extremist insurgency in Africa's Sahel region. The French Defense Ministry says they were working as part of a 5,000-troop mission in an area where terrorist groups are attacking civilians and threatening the regional stability. 44 other French soldiers have died since January 2013, when French troops began their mission in the Sahel. Burkina Faso President Roch Marc Kabore has vowed to bring together the West African nation torn by violent Islamist militant attacks as he embarks on his second and final 5-year term. Mr. Kabore was sworn into office in a ceremony attended by nearly a dozen peers from the region following his victory in a November 22nd presidential election, which he won with 57.87% of the vote. Once a stable country in the turbulent Sahel region, landlocked Burkina Faso has been sucked into a violent security crisis during much of Mr. Kabore's first term. The crisis has also overwhelmed much of West Africa in recent years. Islamist insurgents with links to Al-Qaeda and the Islamic State have killed more than 2,000 people in attacks this year in Burkina Faso. Around 1 million people have been displaced and nearly 7% of the electorate were unable to vote. And now, after winning the 2019-2020 World Oils Competition, Algerian olive farmers look for solutions to save this year's harvest, which they say has been impacted by the coronavirus pandemic and increasingly unstable weather. According to them, the lockdown and curfew imposed to battle the COVID-19 outbreak kept many people at home and away from their fields, where they tend to the trees.
In the city of Tizi Ouzou, an olive farmer said less rain and snow meant less irrigation, adding that a lockdown and curfew imposed to battle the COVID-19 outbreak kept many at home and away from the fields where they tend to the trees. The national production of olives reached approximately 10.3 million quintals during the 2019-2020 season, against the 8.6 million quintals in the previous year. A 65% increase according to Minister of Agriculture and Rural Development, Abdelhamid Hamdani.
Usually there are more olives because there is rain and snow and because olives need this. But unfortunately this year, there aren't many olives because of the lack of water and because the olive trees have not been trimmed.
While olive trees generally do not produce the same year on year, factors such as weather conditions and poor upkeep also contributed to the fall in production in 2020. At the start of the coronavirus pandemic, the Algerian government imposed an intercity travel ban and a curfew on citizens across the North African nation.
This year, we have a decrease in production, a little less than half of what we had last year. Last year, we had a record production, but this year, we forecast around 7 million litres compared to 19 million litres last year.
In the city of Boumediès, extra virgin oil comes from the trees in the center-west of the country. It has won several international awards and exports to Europe.
This year we've had bad production in Algeria. Harvest decreased by 40% like all countries in the world. This is caused by global warming as well as COVID-19.
Earlier this month, Hamdani stressed the ministry's plan to reinforce exports of agricultural products, especially olive oil, according to Algeria's state news agency.
And that's the program today. Thank you so much for watching. I'm Tenyola Shuboale.